Okay, picture this. You're in an operating room. The lights are glaring, everything is on the line, and what's supposed to be a routine procedure is about to go completely off the rails. Today, we're diving into what happens when a surgeon comes face to face with their worst nightmare.
You know, that's a phrase that can send a chill down any surgeon's spine. It sounds like something from a war zone, right? But it describes a very real, incredibly dangerous situation that can pop up in the blink of an eye, right there on the operating table. And really, that's the big question we're tackling. We're going to get inside the mind of a surgeon when the very map of the human body they rely on, the thing they've studied for years, suddenly becomes a treacherous, unrecognizable landscape. So to really get a handle on this dilemma, first we need to understand the battlefield itself. What in the world is a hostile calot, and why is it so feared? So, Calot's triangle is this small, super important area in the abdomen. It holds all these critical structures a surgeon has to find during a gallbladder removal. But when it's hostile, it means severe inflammation has, and this is a quote from the source material, welded everything together. I mean, think about that. Arteries, ducts, tissues, all fused into one messy, confusing, and incredibly dangerous blob. Now, this kind of terrifying situation doesn't just happen out of the blue. There's a specific villain that creates all this anatomical chaos. It's a rare but really serious condition called Marizzi syndrome. To really appreciate the tough choice a surgeon has to make, we have to understand the enemy. So what exactly is Marizzi syndrome? And how does it manage to cause so much trouble in the body? At its heart, Marizzi syndrome is all about a dangerous distortion of the body's normal layout. It all starts with something really common, a gallstone. But in this case, the stone gets stuck, really impacted in the neck of the gallbladder, and that creates a blockage. Well, this leads to massive inflammation, which then puts a ton of pressure on the common bile duct right next to it, and that's a crucial pipeline carrying bile from the liver. And get this, the inflammation acts almost like a rope, physically yanking the common bile duct out of its normal spot and pulling it right into the danger zone. All of a sudden, the surgeon is looking at a completely warped landscape where one tiny wrong move, one wrong cut, could be absolutely catastrophic. And this situation just gets worse and worse over time. It's progressive. It starts with type 1, which is just some external pressure on the duct. But by type 2, that pressure and inflammation have literally eroded a hole, a fistula, between the gallbladder and the bile duct. Then in types 3 and 4, that hole just gets bigger and bigger until the entire wall of the bile duct is just gone. The anatomy isn't just twisted anymore. At this point, it's been completely destroyed. Okay, so faced with this welded together, distorted mess of anatomy, the surgeon is staring down a massive choice. And it's not just a technical problem anymore. It's honestly a philosophical one. And this right here is probably the single most important piece of advice from veteran surgeons. The temptation, the urge, is to be a hero, to push through, to try and meticulously pick apart the impossible, to get that textbook perfect result no matter what the risk is. But that right there is a trap. And here's where the two paths really diverge. The heroic path means you stick to the original plan, risking a devastating injury to a major duct that could lead to lifelong problems or even death. The wise path, though, that means you accept the reality of what's in front of you and you change the plan. You prioritize one thing and one thing only, the patient's safety. So, what does this wise path actually look like? It's not about giving up, not at all. It's about making an expert-level strategic pivot. It's about using what surgeons call the bailout playbook. This is the question every single surgeon has to ask themselves in that moment. When you can't tell what's what, when you aren't 100% certain you're not about to cut something vital, what do? You don't guess. You don't hope for the best. You formally, deliberately initiate a bailout. And listen, this isn't a sign of failure. It's the mark of an experienced, disciplined surgeon who knows exactly how to take control of a chaotic situation. And they have specific plays they can run. One is a fundus-first dissection. Basically, by starting at the top of the gallbladder, the fundus, and working their way down, they stay away from that inflamed, confusing triangle for as long as possible. They're working from known, safe territory towards the unknown. Another great option is a subtotal cholecystectomy. Here, they make a conscious choice to take out most of the diseased gallbladder, but leave a small, safe bit of tissue behind. This neutralizes the immediate threat without risking a catastrophic injury trying to get every last scrap. And all of this brings us right back to the core message of this whole situation. It's about completely redefining what it means to win in the operating room. I really want to let that sink in for a second. In a field that so often celebrates technical perfection and these daring procedures, sometimes the most courageous thing you can do is decide to pull back. A bailout isn't a failure to complete the mission. It's the successful completion of a different, more important mission, keeping the patient safe. Because at the end of the day, success isn't defined by some beautifully perfect dissection that'll end up in a textbook. It's defined by a patient who wakes up healthy and safe. That is the only victory that truly matters. And this lesson goes so far beyond the operating room. It doesn't matter if you're a pilot flying through a storm, a leader in a crisis, or a developer staring down a catastrophic bug. That temptation to be heroic and just push through a dangerous unknown is always there. So the real question this leaves us with is, how do we build the discipline and the culture to recognize when the wisest, strongest, and most expert decision is actually to bail out?